What is the history of understanding stomach ulcers? The journey of understanding stomach ulcers, also known as peptic ulcers, is quite fascinating. It has changed dramatically over the years, from early surgical attempts to today's recognition of bacterial causes and effective treatments. In the late 19th century, surgery was a risky business. The abdomen was often considered off-limits for operations. Surgeons like Pian and Mackenzie tried to treat perforated ulcers, but survival rates were low. By 1901, only a few patients who underwent surgery survived, highlighting the limited medical knowledge of that time. Although duodenal and gastric ulcers had been recognized for centuries, significant advancements in understanding and treatment were lacking. For much of the 20th century, people believed that stress, spicy foods, and excess stomach acid were the main culprits behind ulcers. Treatments focused on reducing acid production and managing symptoms, but the root cause remained a mystery. This changed dramatically in the 1980s with a groundbreaking discovery. Barry Marshall and Robin Warren identified the bacterium Helicobacter pylori, or H. pylori, as a primary cause of gastritis and peptic ulcers. This finding challenged the long-held belief that lifestyle factors were the main contributors to ulcer formation. In a bold move, Marshall even ingested H. pylori himself, developed gastritis, and then cured himself with antibiotics. This self-experiment provided compelling evidence of the bacterial connection. Following this discovery, numerous studies confirmed that eradicating H. pylori could significantly reduce the recurrence of ulcers. By the late 1980s and early 1990s, the introduction of triple therapy, which combines two antibiotics and a proton pump inhibitor, became the standard treatment. This approach directly targeted the infection, and major gastroenterology organizations endorsed it by 1990. As research progressed, scientists identified specific virulence factors of H. pylori, such as the cogagene, which is linked to more severe ulcer disease. Today, we understand that peptic ulcer disease is primarily caused by H. pylori infection and the use of non-steroidal anti-inflammatory drugs. While acid plays a role in ulcer formation, it is not the root cause. Modern treatment focuses on eradicating H. pylori when present, reducing acid to promote healing, and avoiding medications that can cause ulcers. In summary, the history of understanding stomach ulcers has evolved from early surgical recognition of complications to a more nuanced understanding of bacterial causes. This journey reflects the importance of scientific discovery in changing medical practices and improving patient outcomes. If you have concerns about ulcers or related symptoms, it is always best to consult a healthcare professional for personalized advice.